Hi, in this presentation we will discuss about pharmacoeconomic evaluation or pharmacoeconomic analysis. Economics is a broad subject which is usually study of how people allocate limited resources. Health economics is a discipline of economics applied to healthcare, which is study of how healthcare resources are allocated among alternative uses. Pharmacoeconomics is branch of health economics that usually focuses on balancing costs and benefits of pharma interventions with aim at maximizing value to patients, healthcare, payers like insurance companies and society through data driven decision making. Now coming to pharmacoeconomic analysis or pharmacoeconomic evaluation. Pharmacoeconomic analysis is used to determine pharma products' cost effectiveness in relation to comparator treatments. An increasing number of countries have introduced pharmacoeconomic evaluation or HTA, which is health technology assessment, also called HTA, health technology assessment. So increasing number of countries they have introduced pharmacoeconomic evaluation to assess value of drug for specific indication from a medical, economic and social perspective. Pharmacoeconomic evaluation is increasingly being considered in pricing and reimbursement decisions in many countries, whereby costs and benefits of new drug are weighed against those of an existing therapeutic alternatives. Purpose of economic evaluation is to identify, measure, and compare the costs and consequences or outcomes of alternatives to inform value for money decision about intervention or program. Economic analysis provides a valid, replicate, and scientific tool for use to maximize total health gains from available budget. Economic analysis is a tool designed to bring greater rationality to often complex decisions, and it shed light on logic behind the choices. It is used to inform decision making rather than replacing it. Benefits of pharmacoeconomic evaluation. There are many situations where economic evaluation can assist decision makers, like in decisions by different level of government or administrative bodies to fund a program or service or a technology on the basis of pharmacoeconomic evaluation, or in pricing decisions by government regulators and technology manufacturers, and in developing clinical practice guidelines based on pharmacoeconomic evaluations based on their cost and effectiveness, and in decision on priorities for research funding by government and research based firms, and also in post-marketing surveillance and updates of economic information based on use of technology in the real world. Now coming to types of pharmacoeconomic evaluation. There are basically five types of economic evaluation: cost effectiveness analysis, cost utility analysis, cost benefit analysis, cost minimization analysis, and cost consequences analysis. And budget impact analysis is separate. which provides complementary information on budgetary expenditure and affordability issues. So budget impact analysis, it complements the pharmacoeconomic analysis. Choice of appropriate method of evaluation depends on research question and availability of data on outcomes measures to be evaluated. And generally, use of one method does not necessarily exclude the other method. In many countries, more than one method is used for evaluating the different alternatives. Now coming to cost effectiveness analysis or CEA. Cost effectiveness analysis compares relative cost of interventions or treatments against outcome of those treatments. And such outcomes may be like hospitalization days avoided by treatment, strokes prevented by treatment, hip fracture averted by treatment, or life years gained by the treatment. The final result of value called the incremental cost effectiveness ratio. So final result of cost effectiveness analysis is presented as ICER or incremental cost effectiveness ratio, which we'll discuss in the next slide. So ICER, incremental cost effectiveness ratio. Cost effectiveness is usually expressed by incremental cost effectiveness ratio or ICER, which represents additional cost for an additional unit of efficacy between two treatments. Formula for calculating ICER: cost of new treatment minus cost of comparator divided by effect of new treatment minus effect of comparator. ICER enables to determine whether drug is cost effective and its level of therapeutic benefit in relation to comparator drug. A drug is considered cost effective compared to another drug if it provides same clinical effect but at the lower price, or a better clinical effect at the same price, or maybe same clinical effect at the same price. Now example of cost effectiveness analysis. Now suppose cost of treatment with new drug A is 50,000, cost of treatment with comparator drug B is 40,000, and effect of treatment with new drug A is life expectancy increase by 5 years, and effect of treatment with comparator drug B is life expectancy increase by 4 years. Now calculate ICR with the given formula. So cost with new treatment 50,000 minus cost with comparator 40,000 divided by effect of new treatment 5 years life expectancy gain minus effect of comparator 4 years life expectancy gain. So ICR value is 10,000 incremental additional cost for one additional year of life expectancy. So to increase life expectancy by 1 year, new drug is asking for 10,000 extra cost or additional cost. So ICR value in this case in formula is 50,000 minus 40,000, which is 10,000 divided by 5 years life expectancy gain minus 4 year life expectancy gain, which is equal to 1. So 10,000 by 1 equal to 10,000. So ICR value is 10,000. So 10,000 additional cost is needed for gaining one additional years of life. Coming to cost utility analysis. Cost utility analysis is similar to cost effectiveness analysis, but only difference is the outcome is measured in quality adjusted life years or QALY, QALY, quality adjusted life years gain. Result of cost utility analysis should be expressed as incremental cost utility ratio. So incremental cost utility ratio is defined as change in cost and benefit, where benefits are measured as quality or quality adjusted life year. So change in cost and benefit resulting from substituting one treatment for another. Let us discuss the quality adjusted life years. Quality considers both quality of life as well as quantity of life. So life years adjusted by quality of life. One quality is equivalent to living 1 year in perfect health or living 2 years at half the perfect health. Now let us understand the calculation of quali. Suppose total life expectancy left is 6 years. First 4 years with 100% quality of life. So quali for first 4 years is 4 into 1. 1 is for 100% quality of life. Fifth year with 50% quality of life. So fifth year quali is 1 into 0.5. 0.5 is for 50% quality of life. And sixth year with 25% quality of life. So 6 year quali is 1 into 0.25. 0.25 for 25% of quality of life. So equal to 0.25. So total quali is 4 year in perfect health, which is 4. Fifth year with half the perfect health, which is 0.5. And sixth year with 25% of quality of life, which is 0.25. So quali will be 4.75. Now let us understand with an example for cost utility analysis. Suppose cost of treatment with new drug A is 60,000, treatment with comparator 50,000, quali with new drug is 5, quali for comparator drug B is 4.75. So the result of CUA should be expressed as incremental cost utility ratio or ICUR. So ICUR calculated equal to cost of A minus cost of B, 60,000 minus 50,000, which is 10,000, divided by quali of A minus quali of B, which is 5 minus 4.75. So quali difference will be 0.25. So ICUR will be 10,000 incremental additional cost for 0.25 additional quali gain. So that will be additional 10,000 will be required with the new treatment A compared to treatment B for gaining additional 0.25 of quali. Coming to cost benefit analysis or CBA. Cost benefit analysis measures cost and benefit in monetary term. So benefits or outcomes are also converted into money value. So both the value cost and outcome are in money value now. Now it expresses the results as one figure representing difference between benefit and cost. So results are expressed as either benefit minus cost or as ratio of benefit divided by cost ratio. Let us understand with example. Cost of treatment with new drug A is 20,000. Cost of treatment with comparator drug B is 10,000. Benefit which is converted into money value with drug A is equal to 45,000. Benefit converted into money value with comparator drug B is 20,000. Now expressing result of cost benefit analysis as benefit by cost ratio. So if you calculate benefit by cost ratio in this example, which will come to 2.5. So benefit is difference in benefit 45,000 minus 20,000 with drug A and B, which is 25,000 divided by difference in cost of two drugs, 20,000 minus 10,000, which is 10,000. So 25,000 divided by 10,000 is equal to 2.5. So benefit by cost ratio is 2.5. Hence the new drug A is providing 2.5 times benefit as compared to comparator drug B. New drug A is providing additional benefit of 25,000 with additional cost of 10,000 as compared to drug B. Now expressing result as benefit minus cost. So for new drug A, benefit minus cost is 45,000 minus 20,000 is equal to 25,000. For comparator drug B, benefit minus cost is 20,000 minus 10,000 is equal to 10,000. Hence, new drug A is providing higher benefit, which is 2.5 times higher as compared to drug B. Now coming to cost minimization analysis. Cost minimization analysis assumes that there is no net health change between different treatment options. That is, there is no significant difference in effectiveness of each drug. So both drugs are equally effective. So outcome are same with the both drugs. So in this case, analysis is essentially a search for least cost alternative. Let's understand with example. Cost of treatment with new drug A is 20,000. cost with compared drug B is 15,000, and both drug A and B are equally effective. So outcome are same with both drugs. Now cost minimization analysis result is treatment with drug B is cost effective, which is 5,000 less costly as compared to new drug A. So drug B is more cost effective. Coming to cost consequences analysis. In cost consequence analysis, cost and outcome of alternatives are listed separately in disaggregated format. For example, intervention costs are listed separately for both drug, hospital costs listed separately, clinical benefits are listed separately, adverse events are listed separately. So in this type of evaluation can be useful for obtaining a picture of the impact of each intervention. So consequence analysis is not very highly used by countries. Now comparison of type of economic evaluations. In cost minimization analysis, cost is in money term and outcome is none because both the treatment are equally effective. They are not compared. They are equally effective. So only cost are compared in cost minimization analysis. Cost effectiveness analysis, cost of drug is in monetary term and outcome is in natural units. For example, life years gained. And results are expressed as cost per outcome unit. For example, in this case, cost per life year gain is result. Now, in cost utility analysis, cost of treatments in money term and outcome are expressed in quality or utility values as quality adjusted life years. So results are expressed as cost per quality adjusted life year gain. In cost benefit analysis, costs are in money term and outcome are also converted into money term. So result is net cost. Comparison of economic evaluation with budget impact analysis. Question addressed in economic evaluation is it value for money? Is the drug is value for money? And in budget impact analysis, it's asked, is it affordable? Goal in economic evaluation is efficiency of alternatives. And goal in budget impact analysis is plan for financial impact. Health outcome in economic evaluation is included. In budget impact analysis, it is excluded. Economic evaluation measures added cost per unit of benefit or outcome. And in budget impact analysis, it considers only total expenditure. Time horizon in economic evaluation is usually longer, maybe lifetime. But budget impact analysis time horizon is shorter. Budget is usually prepared for 1 to 5 years. Now, recommended method or recommended pharmacoeconomic evaluation techniques in different countries. Like in US, CUA and CEA are used. In Canada, CUA, CEA, CMA, CBA, and CCA, they are used based on availability of data on outcomes. In Brazil, any of the 5 methods can be considered. Mexico, cost effectiveness and cost utility are used, but cost minimization can be used but it requires justification. In Cuba, CBA, CEA, CMA, and CUA are used. In New Zealand, cost utility analysis is used. In Australia, any of the 4 techniques mentioned here can be used, but need justification. In China, cost utility analysis is used. Taiwan, usually cost effectiveness, cost utility are used based on outcome measures like life year gain and quality. Malaysia, cost effectiveness and cost utility used, but need justification. Thailand, cost utility analysis is recommended. Israel, cost effectiveness analysis is used. South Africa, any of the 4 techniques listed can be used with justification. Egypt, any of the cost minimization, cost effectiveness, cost utility is considered. In Russia, any of the 5 techniques can be used along with the budget impact analysis. Austria, CMA, CE, and CA are used. Denmark, cost effectiveness and cost utility is used. Hungary, CMA, CE, and CUA. Italy, CEA and CUA. Spain, any of the 4 analysis methods CMA, CA, CUA, and CBA, they can be used. Croatia, cost effectiveness analysis and cost utility analysis are preferred. Latvia, Lithuania, Estonia, any of the CMA, CEA, and CUA with justification can be used. In Belgium, cost effectiveness analysis and cost utility analysis are used. In France, any of the five listed techniques with justification can be used. In Germany, cost effectiveness and cost utility are used. Ireland, usually cost utility analysis is preferred. Netherlands, CEA, CUA, or CEA or CUA are used, but no CMA, no cost minimization analysis is used. Norway, cost utility analysis is used. Portugal, any scientific recognized method such as CMA, CA, CUA, CBA. Slovak Republic, cost utility analysis is used. Sweden, CA and CUA. England and Wales, cost effectiveness and cost utility are used. Finland, any of the CMA, CA, CUA, and CBA. Poland, CCA, CA, and cost utility analysis, they can be considered. Scotland, any of the five listed techniques with justification can be. Now, coming to key consideration in pharmacoeconomic evaluation. Effectiveness method is used instead of clinical efficacy. Use of effectiveness is used instead of efficacy because effectiveness provides health improvement achievement in actual practice rather than in controlled clinical practice. Measure of effectiveness should include measure of effectiveness ends like measure of morbidity, mortality, changes in quality of life. In some cases, results of clinical trial may not provide sufficient input for economic evaluation of healthcare outcome. In such cases, it must adjust or supplement data through a modeling exercise. Use of modeling in pharmacoeconomic evaluation is always recommended where warranted, and it incorporates scientific evidence instead of replacing it. Other considerations are cost consideration, budget impact consideration, time horizon. Time horizon of a study should be long enough to capture all costs and clinical outcomes directly related to input of health. Discounting of costs and health effects or cost adjustment for inflation. For assessment with longer than 1 year time horizon, cost and prices used in cost analysis should be adjusted. Preparation of results. Interpret the description and interpretation of results should be focused on answering the study question raised initially. So presentation of results should be focused on answering the study question raised initially. Sensitivity analysis on parameters, uncertainty. It is necessary to conduct analysis or feasible range of variation of parameters whose uncertainty could be significantly affected by results. Comparison with previous studies. Comparison of results should be carried out with studies previous economic evaluation. If there are differences, then one should evaluate the reason for differences. Ethics and equity consideration. It is desirable to have a discussion on ethical consideration and present data related to the introduction of new input or methodology equity analysis used for evaluation. That's all in this presentation. Thank you very much.